Welcome to Integrating a Plan of Action into Your Life, Session 7 of the Learning Series Living Well with COPD by RESPIPLUS. Living well with COPD means being aware of changes in your symptoms and being prepared to manage them. In order to be ready, you will need to plan out your actions, and that is exactly what this session is all about, your plan of action for life. I am Becky Zuko, and I have been accompanying you through this exciting series. As an exercise physiologist, I've had the opportunity to help many people with chronic disease improve their quality of life through exercise rehabilitation. The development of this learning course was made possible through a non-restricted educational grant from AstraZeneca Canada to RESPIPLUS, a non-profit organisation which directs the continuous development of Living Well with COPD programme. Today, we will be helping you build your action plan. You will need to identify your resources. You will learn to identify your usual symptoms, your regular treatment, and what to do when you feel well. You will learn to recognise and be prepared to act when your symptoms get worse. Your plan of action plays an important part in your life, as it will help you make key decisions in managing COPD, and especially when your symptoms get worse. Your plan of action will help you to better recognise your everyday symptoms and list what you are doing every day to remain well, including taking your medication as prescribed. Recognise a worsening of your symptoms and the situations that can trigger it. Know what to do to prevent a worsening of your symptoms, and know when and whom to call if your symptoms get worse or do not improve. A plan of action includes the following sections: a contact list, I feel well, I feel worse, I feel much worse, I feel I am in danger. Remember, the main objective of your plan of action is for you to know how to act promptly when your symptoms get worse. An essential part of your plan of action is to have the phone numbers of your contacts close at hand. These are the key people you can call when you have a problem with your symptoms or treatment. Write down their names and numbers and always have this information at hand. Let us look at your plan of action when you feel well. In order to be able to recognise changes in your symptoms, you first need to know what your usual symptoms are when you feel well. In your case, what are your usual symptoms? What kind of activities can make you short of breath? Do you have secretions or sputum on a daily basis? If so, which colour? Do you cough regularly? Learn to know your body and note the changes so you can share with your resource person. To continue to feel well, it is very important to take your regular medication as prescribed. Can you list the medications you take on a daily basis for your COPD? Remember that it is very important to take your respiratory medication as prescribed and using the proper inhalation technique. Do not hesitate to discuss with your doctor or resource person any questions or concerns you may have about your regular medication. Finally, what kind of activities do you do to keep feeling well? As you have seen in previous sessions, sleeping well and a good nutrition are very important to remain healthy, as well as keeping physically active. It is important to plan your daily activities. For example, you may use a schedule for your housekeeping chores, take breaks when needed, and use your pursed lip breathing technique. It is also important to prevent a worsening of your symptoms. Are you getting your flu shot every year? This vaccine is important because it will help you prevent the flu and related complications. You and the people you are living with should get a flu shot every year. Avoid people who have respiratory infection, such as a cold or flu. Wash your hands if you are in contact with them. And avoid smog. If the air quality is not good, then try to stay indoors. Have your symptoms got worse lately? What happened the last time they got worse? What did you do? A respiratory infection is the main trigger that can cause a worsening of symptoms in COPD, also called an exacerbation or flare-up. The symptoms of a respiratory infection are changes in the colour, volume and/or consistency of your sputum. Your sputum may be yellow or green, sometimes only darker. You may produce more sputum. Your sputum can become thicker. 2. More shortness of breath than usual. You find it harder to perform your usual activities, and you may feel tired. Remember, you may have a cold or flu-like illness and/or sore throat preceding the changes in your sputum and shortness of breath. In your case, which symptoms tell you that you have a respiratory infection? This is your plan of action when you feel worse. Number 1. Monitor the changes in your symptoms. Changes in your sputum, more shortness of breath than usual. And very importantly, notify your resource person or seek your physician advice. If you have been prescribed an additional treatment, please refer to the instructions of your physician. Number 2. Avoid things that may make your symptoms worse. Number 3. Use your breathing, relaxation and body position and energy conservation techniques. In some cases, an additional treatment will be needed. You have to look promptly at the changes in your symptoms in order to decide what actions to take. Observe the changes in your sputum colour, volume and consistency, not only in the morning. If the colour becomes yellow or green, you may have a bacterial infection and your doctor will probably prescribe an antibiotic. Do not wait more than 48 hours to see your doctor or contact your resource person. If you have more shortness of breath than usual, you should quickly increase your rescue medication, bronchodilator, as prescribed by your doctor. Do not wait more than 48 hours to see your doctor or contact your resource person if, after increasing your rescue medication, your shortness of breath does not improve and you have difficulty performing your usual activities. What should you do if your symptoms are not getting better despite taking the treatment prescribed by your physician? If your symptoms get worse or do not improve after 48 hours of treatment, contact your resource person or go to the hospital emergency department. In any situation, when you feel you are in danger, do not take a chance. Call 911. For example, if you are extremely short of breath, you feel confused and/or drowsy, or you have chest pain. Your symptoms can also get worse temporarily by exposure to environmental factors or because of stress and emotions. Let us see how you can manage your symptoms in these situations. Environmental factors such as cigarette smoke, smog, or changes in temperature can make your symptoms worse, especially your shortness of breath. You may also cough more or have more sputum. Your symptoms should only get worse for a short time. To prevent your symptoms from getting worse, avoid the things you know will make them worse. If you cannot avoid the things that make your symptoms worse, use your rescue medication 20 to 30 minutes before you are exposed to them. If your symptoms get worse or do not improve, contact your resource person or go to the hospital emergency department. Remember that stress can lead to real physical reactions such as an increased shortness of breath, increased heart rate, perspiration, etc. A stressful situation in many cases can be controlled without medications, with the help of breathing and relaxation techniques. The use of your rescue medication might be necessary. If, in any situation, your symptoms get worse or do not improve, contact your resource person or go to the hospital emergency department. Remember, consider inviting a close family member or friend to your COPD education sessions so that they can understand what you are going through. Discuss with your resource person the possibility of getting referred to a social worker if stress and anxiety take a lot of place in your life. In summary, your plan of action should be your constant companion. This is your plan of action for life. What can you do to feel more confident about using your plan of action? It is important that you contact your resource person and your physician to review your plan of action and get all information needed on how to use it, particularly in the presence of a symptoms worsening. To learn more about today's topics, consult the learning module Integrating a Plan of Action into Your Life. Available for free at www.livingwellwithcopd.com. We would like to acknowledge all the professionals and patients who have contributed their time and thoughts in order to enrich the Living Well with COPD programme, and especially Mrs. Pauline Anderson. Their dedication and help has allowed us to continue enhancing the lives of people living with this disease and their loved ones. Thank you.